As the country gears up to roll out the national health insurance, its number one citizen has rallied the nursing profession for support, highlighting that they are the cornerstone of universal access to quality health care.
The support of DENOSA will be pivotal as we prepare for the national health insurance. The passage of the NHI Act was in many ways a milestone in our ongoing quest for a more just society where one's ability to access quality health care and services is not determined by where one comes from or from one's ability to pay. The NHI will bring us closer to our aspiration of being a society where human dignity of all is upheld at all times. The right to dignity matters most when people are sick, when they need help, and that is the time when they are most vulnerable. Our nurses will be the backbone of the national insurance, health insurance. You are going to be the real backbone. When people look at how we're implementing the NHI, the first point of call will be the capability, the ability of our nurses to be able to improve the delivery of healthcare in our country.
Ramaphosa also emphasized the need for the country to find ways to be self-reliant and use its resources. That's after the US cut off USAID and PEPFAR funding to the country.
Well, we've had discussions about the stoppage of funding, and it is entirely within their own right. I mean, it is their money, and in many ways it's a wake-up call on our part as South Africans that we've got to find ways of being self-reliant, of relying on our own resources, and that is what our people expect. Even within our fiscal constraints and challenges. So this is a matter that we are discussing. And our sovereignty is important, and our sovereignty as a country should also mean that we must find ways all the time to look after the welfare of South Africans.
Meanwhile, the man at the helm of DENOSA says addressing the challenges that nurses face must not be rhetoric but practical.
Nurses are the backbone of nursing care, but also health care in general in South Africa. However, it should not end in the rhetorics and the speeches. There must be realities on the ground. Nurses who are unemployed must be employed. We must add the numbers in terms of training of nurses so that we can realize NHI, or what we call universal health coverage. Because without the nursing workforce, you will never deliver any universal health coverage in the country. There are many deep rural areas where any other professional can never get, but a nurse can get. There are many clinics that are manned in rural areas where you don't get another professional except a nurse. So it means you need more nurses to be able to do that. But further than that, there's many nurses who are entering into private practice. They can be contracted to go and service the far-flung and far-reach areas as private practitioners and then beneficiate by claiming from the NHI fund, which means we can then deliver healthcare without limitation, because in the past, Mama Albertina Sisulu, they were riding bicycles and going to Sophia Town to deliver people.
The safety of nurses at healthcare facilities, nurses' wages, working conditions, and nursing education and professional development are among some of the key issues that will also be discussed at the Congress, which concludes on Friday. Natasha Piri, SABC News, Benoni.